This morning we are meeting the new president of the Saskatchewan Union of Nurses, Bryce Boynton. Thank you for coming into studio this morning.
Good morning. Thank you for having me.
Congratulations. How does it feel to win?
It's been a whirlwind, but there's been a lot of great staff to support me through this orientation process, and I'm having a blast so far.
What prompted the run?
Right now we're in crisis. Nursing is in crisis, healthcare is in crisis, and so we're needing to engage in a new way to highlight the issues that nursing's seeing, and the members felt I had the chops to do it, and so I'm excited to work with them to make some changes happen.
What is the new way?
The new way is nurse-patient ratios, ensuring we prioritize retention and not just recruitment. I'm ensuring that we have our mid to late career nurses sticking around to better support our new nurses and our new internationally educated nurses, but also because they bring a wealth of knowledge, and so I'm wanting to prioritize them and ensure we move away from just a purely recruitment focus and prioritize a retention focus and stabilize that workforce and ensure they feel valued so they want to stick around.
Bryce, what's your background?
My background, well, I was born and raised in Saskatchewan. I've had the chance to work all over Saskatchewan, city, rural, remote, most recently residing in La Ronge as a public health nurse.
What have you seen over your time?
I've seen a lot, but I've seen a slow degrading of our healthcare system to where we're struggling. We're seeing a lot of burnout. We're seeing nurses not able to keep up with necessarily the workload because there's so many things tossed their way now because of complex health issues, and a lack of resources to support that. And so I'm hoping we can make some differences on that front.
What's the message you want to get through to your members and to the government? Well,
first and foremost, for the members, I'm here for you. I want to make sure we're working with you to get what you need to do your job. And we do that through a few different ways. Like I said, we want to prioritize retention, and we want to ensure you feel supported. But how we do that is through the nursing task force. Right now, we've been discussing the nursing task force with government, and it was an election promise. We're wanting to make sure we follow through on that, and so that we can address these issues that are facing nursing and healthcare, and we do that through the task force with all of our colleagues at the table. But we need to ensure that that task force has decision-making capabilities and resources behind it so we can actually make some real differences.
You're making real differences in La Ronge lately. The wildfire situation is getting better in the province, but there was a lot to happen there.
Yeah, that's home for me, and so it was a bit tough. I went up this weekend here just to check on things and see how things were. I'm very fortunate where my home is okay. But that's not the same for everyone. A lot of my colleagues, some of them lost their homes, including one of our own nurses. And so it was a bit tough to hear from them, but we're doing what we can to support them right now. And I just want to take this opportunity to thank all of the healthcare workers, the firefighters, the first responders, the volunteers, and of course, our nursing team. They've done some great work. They were, helping with the evacuation of the health center there. They helped with the evacuation of the long-term care center. They
set a big lift. Oh,
it's
huge.
That's
a massive lift.
It's huge. They set up a field hospital, and they helped with those who were displaced in other communities. And we even had a nurse who was sticking around fighting fires. So nurses, they were doing it all, and so I just want to take this opportunity to praise them and praise everyone else who was involved in the situation to help out.
Well, we thank all of our healthcare workers, of course, as well. If somebody has some information that they'd like from your organization about what you do or how you can help out, where do they go to get that?
Sure. So we have the Sask Nursing Crisis page right now. It's SASK Nursing Crisis, and you can find all about what's going on in Saskatchewan there and how you can find more information from there and help out.
Bryce, thank you for this. Let's do it again soon.
For sure, Austin. Absolutely. Thanks for having me.